The ankle brachial index, also referred to as the ABI, is the gold standard for peripheral artery disease. It is a quick and simple test to check for peripheral artery disease, which occurs when the arteries narrow. As the arteries narrow, less blood is able to flow to the arms and legs. Individuals with peripheral artery disease can experience pain while walking, as well as cold feet. But the real concern with the disease is increasing the patient's risk of heart attack and stroke. Thus, it is important to test and screen. Risk factors include tobacco use, diabetes, high blood pressure, atherosclerosis, and high cholesterol. The test compares the blood pressure at the ankle compared to the blood pressure assessed at the arm. The test is completely painless. The patient will experience similar sensations to that of having their blood pressure taken at the doctor. The test is done with the patient laying down on their back. The patient needs to be at rest for 5 to 30 minutes prior to starting the test. A handheld Doppler is used along with the blood pressure cuff to perform the test and assess the blood pressure at each site. The blood pressure cuff restricts the blood flow to the area as done in a doctor's office. The Doppler is placed distal to the blood pressure cuff on the artery to better listen to the blood flow through the artery. The clinician is listening to find the systolic number. The diastolic is not applicable for this assessment. The test would then be repeated on the patient's other side. The ratio is the systolic blood pressure at the leg divided by the systolic blood pressure at the arm. A low ankle brachial index number indicates that the arteries in the leg are narrow or blocked. 1 to 1.29 is a normal ratio. Less than 0.9 indicates peripheral artery disease, meaning that your patient needs to have further testing to view the arteries of the leg. Specific to physical therapy, a ratio of 0.7 would mean that the compression for edema is contraindicated. Overall, it is important for physical therapists to be aware of their patient's blood perfusion to better understand their overall health. Physical therapy can be used to improve circulation and help reduce pain that the patient might be experiencing with peripheral artery disease.